how the storm is impacting hospitals and emergency response, I want to bring in Jyric Sims. He is the president of the HCA Healthcare West Florida Division. Jyric, first of all, thank you for your time, sir. But one of your hospitals flooded and partially lost power. Can you walk us through the process of transferring the nearly 250 patients you had there?
Thank you, Alex. First off, thank you for having us. And first off, I'll just start off with HCA West Florida Division. We have 16 hospitals up from Citrus all the way down into Fort Myers area. So we were preparing for this storm well in advance. About 4 days out, we had assembled our emergency operations center in coordination with our Nashville operations with HCA in order to really fundamentally set the stage for our response to this crisis. So we knew it was actually coming up. So we were prepared and ready to act when inevitable the hurricane actually came ashore. So through the Largo Hospital that you're talking about, we really saw the best and brightest of our teams, our caregivers really band together for one purpose, and that's to ensure that our patients were safe, they were cared for effectively, and ultimately we got them to the next level of destination. So indeed, our hospital lost power. When it was safe and secure for us to transfer our patients, we were able to do that to nearby local hospitals, but we were able to also transfer those within our HCA network. It was over 200 hospitals that went to our hospitals throughout the greater Tampa area, our sister division in on the East Florida, and some in our North Florida region as well.
Jyric, what's the biggest challenge your hospitals are facing right now?
Well, we're just trying to get back to some sense of normalcy. Obviously, anytime you respond to an event that's this massive, it affected millions of Floridians. So our hospitals span from our North Market into Pinellas, into Hillsborough Market, and where Tampa's located, and down south. I would say our biggest challenge right now is just ensuring that we can continue care. Ahead of this storm, we actually closed 4 hospitals that were located in flood zones. We de-risked actually taking our most critical patients, transferring those to local hospitals to ensure that they're not in harm's way. But in general, we were prepared for it. And now on the rebound, as we kind of come back into operations, our biggest challenge right now is just ensuring that we're able to meet the healthcare needs of the community. Clearly, people are sick, and clearly they're needing access to our resources. We have diligently reopened all of our closed hospitals with the exception of one, and we anticipate that this one hospital will be online with us here in the near future once we can reestablish operations.
Well, and how are hospitals mitigating and prioritizing, health risk for patients right now?
Well, fundamentally, we work in close concert with our physicians, with our nurses, and all caregivers to ensure that we have all the operations and all the clinical capabilities that are necessary to provide care. Our emergency rooms are well equipped with highly trained, highly competent staff who are there to provide care for these particular patients. So I think we're ready for the challenge. And look, we are a community of hospital providers in greater Tampa area that was ready, able, and willing to respond to this crisis. So I feel really good about where we're at, and how we're prioritizing is we're putting the patient first. We want to ensure that every patient who we're privileged and honored to serve in our community gets the highest level of care, and we're actually providing that right now for them, Alex.
It's not lost on me that, hospitals are run by people. People live in the community. I'm curious, how have these hospital staffs been impacted personally by the storm? Do you have an assessment on that?
Alex, quite greatly. Being part of the community means fundamentally that our caregivers and others are directly impacted by this. You're absolutely right. They've lost homes, they've lost cars, and we're incredibly sensitive to that. Number one, we did a reunification. We had text blasts, emails, calls went out to ensure that we not only connected with our patients, but that we connected with our caregivers. Equally, through HCA Healthcare, we have actually bought, and to your prior segment with gas stations being out on fuel, we actually brought gas tankers into the market to ensure right now that our caregivers have gas, they can fuel their car, they can not only get to work, but they can get to their other places of personal business as well. We have mini marts set up through many of our hospitals where our caregivers can actually get food if they're in need of that. We have a multitude of resources that we've brought to bear here in the market to ensure not only we're meeting the community need, we're meeting our employees' need, because we are embedded within our community, and we ultimately know that a healthy community first starts with having a healthy healthcare ecosystem, and that is our principal focus.
All right, Jyric Sims, thank you for your time, sir. And if you are impacted by Hurricane Milton and need help or any resources, you can call the FEMA hotline at 1-800-621-3362, or you can download the FEMA app.